Yes, good morning, Daktari. How are you?
I'm fine.
What do you have for us today?
Eh, karibu watazamaji kwa channel yangu. Mimi ni Daktari Eric na leo tunaenda kuongelea about headache. Headache ni maumivu, yani pain around the head region, na pain zinaweza kuwa ni zile characteristics kwa tunasema uko na which kind of pain. Pain lazima kukuwe na onset, kukuwe na duration, kukuwe na associated symptoms, kukuwe na aggravating factor, relieving factor, na the nature of that pain. So we are having two classification ya headache. One, we are having primary headache, which this one doesn't have any cause, the pathological cause, it doesn't have. Then type 2, we are having secondary headache, which has a pathological cause. So in primary headache, we are having so many types or classification. The first one is migraine headache. Migraine headache is a pain that comes on one side of the head. Like you find you having one pain on right, left, and left side. And this pain mostly it may be by use of some of the drugs, like you find you are using caffeine, and you are using some of the drugs like family planning. Family planning also causes, like the oral contraceptives, they cause also headache. Another type is tension headache. This one is a headache that comes the forehead until goes to the occipital region. It's around the forehead, and this it's a headache that mostly you find you are depressed. You can have this kind of headache, and also your anxiety. You have this headache. And then the fourth type is the cluster headache. Cluster headache, it have two sources. One, around the sinus, you find you have this pain around the behind the eye. So you can get that headache. Maybe you have a problem with your eye. You can also find you have inflammation with the sinuses. That one is a kind of a headache. So this pain comes with risk factors. Risk factor number one is alcohol. You drink a lot, and you find that most of these people, they urinate a lot, so they lose more of water, so they come with the dehydration. Some so some of the risk factor is the dehydration also. You lose a lot of water, but you don't replace. You find it, you are getting this kind of headache. So anxiety, depression, those one are the risk that you can find, and also getting addicted to some of these drugs like oral contraceptives. You can get this headache, like you are put on a long duration of aspirin. You can get this kind of headache. Caffeine, you can get. Some of us, they get addicted to caffeine, so they can't do like those kind of analgesics. So you find that if you get this many, you find you get this headache. And also smoking. There are so many things that the risk that you can get this kind of pain. So a patient come to you with a kind of headache, like the migraine headache. Migraine headache, you find women are prone to migraine headache, the one side, because of we have talked about oral contraceptives, and the cluster headaches, the headaches around the eye, behind the eye. This one is to men. Most of the time they get used to maybe computers more than any work, office work. They are never dehydrated. So you find you get this kind of headache. And after primary headache, you go to secondary headache. Secondary headache, there is a pathological. There is something that triggers this kind of headache, and it is maybe a tumor in the head. You are fallen, you are bleeding to the head, and then you find like hypertension crisis. We talked about hypertension, you can remember. This one also you can lead to stroke. You get such pains around your head, and also angina. We talked about, you can get also this kind of headache because of the pressure applied when the blood pressure travels around the vein. And also you can get abscess due to maybe infection to the meninges, like bacterial meningitis. You can also get, this one is a secondary headache. So and that is some of the things that minor that our client must know, that these lenses also introduces pains, because a lens, you wear a lens like sunglasses. As you wear, they trigger the pain, which is cluster pain. So you find that these patients comes, you have not taken the examination and the history very well. You might want to find that it's an infection, but if you take a good history and physical examination, at least you are going to help a patient than doing those tests and like blood test, but it is not going to help. From clerking the patient, getting to history, and then examination, you can help these patients to know what is the cause of this pain. So to people who are wearing glasses, you wear glass, you don't have any eye problem. Never wear any glass. If you want to wear a glass, maybe for beauty, you go for a orthopedics review, just to measure your lenses. You never provoke the head and the pain around the cluster headache. So after seeing all this, somebody tells you, how can you diagnose this one is a pain, a pain that's associated with infection or secondary, and same thing like that. So we do multiple diagnosis. We first send you for lab. We send you for ESR. ESR will show us which kind of infection. Like you find you get arthritis headache just around the joints of the head or the neck. You can get that pain. And also we do full hemogram, just to find if we are having infection. We do lumbar puncture, just to find diagnostic of meningitis and also other viral infection. You can after doing this, you can go for a CT scan. You can do CT scan to rule out any hematoma. You can do MRI, and those ones will try to give you that picture of a secondary headache. And So to our clients, uh, just to try to avoid this kind of headaches and maybe using of so many drugs. You find a patient, like I had a scenario that patients uses so many analgesics, but the problem is just to take a good history and finding the cause of this pain. So the first thing you should need is taking a good history, and also just booking these patients for a specialist. Like you can book this patient cluster headaches. Uh, Please send them to ENT for ENT review. For the cluster headaches, you can also send them to our orthopedics review just to check on the eyes. And then for after doing this, you can send for the CT scan, MRI. So for management, just you should deal with the rehydration. Just take a lot of water, and then use this analgesics like paracetamol, tramadol. There is a group that you should start from the mild analgesics to the superior analgesics. So please, if you are watching this video for the first time, please remember to subscribe, like, comment, and support your daktari.
Asante
Let's
sana
meet.
daktari. Asante sana for your information. Thank you.